Hello, my name is Andres Moran Lazo. My topic is shoulder international rotation, passive range of motion, both in the sidelying and semi-sidelying position. The definition, passive movements are administered on a regular basis for the treatment and prevention of contractures. They are usually administered manually by physical therapists and carers. The primary goal of passive movements is to improve joint mobility. The shoulder is a joint with a wide range of motion. They perform the internal rotation movement of the shoulder. The patient must be in 90 degrees abduction position and the elbow flexed at 90 degrees. 90 degrees. The internal rotation is 90 degrees and 110 degrees.
Manual resistance strengthening for side lying external rotation. It's one of my favorite exercises. What we're going to do is we're going to take a towel roll. We're going to put it between his arm and his body. That's to make sure that he keeps good form. He doesn't come up into abduction and compensate. And then my proximal hand is going to start by pushing his shoulder forward. What that's going to do is that's going to cause him to have to retract and really set the scap and start with a really good base of support for the beginning of this exercise. Then what we're going to do is I'm just going to apply the resistance, and by doing it manually with my hands, I can assure that there's a nice consistent amount of resistance throughout the entire range of motion. So it's a lot better than tubing or dumbbell exercises where maybe that resistance will change throughout the range of motion. Now, one quick tip, it's real easy to start off in this position and to overload them. Go easy at the beginning and kind of gradually ramp up as they go through the range of motion.
In the application in physical therapy, passive moving are generally performed in patients with muscle weakness and need to be mobilized to avoid muscular atrophy and also help vascularization. The shoulder internal rotation movement is usually performed in the supine position. When performed is the serolateral position to strengthen the muscle because the movement is against gravity.
We've gone through first the warm-up technique, then we went through the second technique, which is flexion. The third technique, which I'm going to show you, is by far the easiest. When I let him down, I set him down on the pillow. You're simply going to keep the arm resting on that pillow. I'm going to take his arm off of his stomach and bring him up here. You can see his arm is approximately 45 degrees from his body. Typically, what I would do is I would sit on this side of the table and gently push his arm back towards the table. In this instance, so that we can see the motion in the camera, I'm behind him. I typically would not be for this motion. It's easier and more comfortable to sit right next to the patient or to stand right next to them. But as you can see, I'm gently going back to neutral and rotating him back towards the table. The same principle applies as with flexion that we did earlier. You want to take him to 4 to 5 out of 10 pain, or where you feel a nice stop or a tension in the joint, a tightness in the joint where he's going to feel that pain. You're going to do this repeatedly, maybe 3 to 4 minutes before you stop and give him a rest. The other gentle stretch you can do out of this position, and I am in the position that I would normally be for this, is you can just gently go in the opposite direction. I'm going to do the exact opposite of what I just did. I'm going to push it down towards his belt, down towards the other side of the table. This is not a motion that is typically limited for these people post-rotator cuff repair. So it's easier for them and less painful, and frankly not as important. So I don't typically have patients spend as much time being stretched into this direction because it is not as limited in this position. as I alluded to in the previous clip, it's easier to have them just resting on the pillow, you sitting right next to them, and you can gently rotate them back using your right hand. You can also switch and push with the left. Rest your right hand on the shoulder to feel what's going on. Also, when you have your right hand on their shoulder joint, you can get a little better feeling of if they tense up. If they tense up, you're simply going to stop the motion until they relax, and then you're going to continue to push it into that tightness or pain that you're looking for.
We have pros and cons. In the pros, helps prevent muscular atrophy and improve circulation, and they can be done by the same person through the health site. And the cons, it must be monitored to prevent it from performing the wrong movement, and performing the movement in a lateral position will be equivalent to a greater energy expenditure for the physical therapist. Issue applied in Ecuador. In Ecuador, a study was carried out in the city of Ribamba. 50% patients between 15 and 16 years of age who were carried derived from traumatologists and with a clinical diagnosis of painful shoulder. Through passive mobilization, the pain decreased from 8 to 5 in a week and improved joint range. In the conclusion, the passive movement of internal shoulder rotation is not recommended in the lateral and semilateral position. It is excessive expenditure of energy when the performer against gravity, because the passive movement is performed by the physiotherapist, and it will be more effective to perform in the supine position.
In this video, we'll be demonstrating sideline external rotation, used in strengthening the rotator cuff. To position yourself, lie on the unaffected side. Place a roll towel under the affected arm to maintain shoulder neutral. While maintaining the arm at a 90-degree angle, lift your hand as high as you can without rotating the trunk or bringing your shoulder blade back too far. Hold 3 seconds and slowly return to start. Complete 2 to 3 sets of 10 every other day. If pain persists, stop the exercise.
Thank you.